Welcome back to Metta Health Talk. Today we are discussing a tiny organ that causes massive pain. Imagine this. You go out for a rich dinner, maybe a burger, fries, or pizza. You feel fine. But 30 minutes later, you are hit with an excruciating cramping pain in your upper right abdomen. It feels like a knife. It radiates to your back. You can't get comfortable. This is the classic presentation of biliary colic, commonly known as a gallbladder attack. Millions of people have gallstones. Many don't know it until that first attack hits. Today, we are going to explore the chemistry of bile, why stones form, and the controversy between surgery versus natural remedies. We will specifically look at the gallbladder flush trend and see if it holds up to scientific scrutiny. First, what is the gallbladder? It is a small, pear-shaped pouch located directly underneath your liver. The liver produces bile, a green fluid, to help digest fat. But you don't eat fat 24/7. You don't need bile dripping into your intestine all day. So, the gallbladder acts as a storage tank. It stores the bile and concentrates it, makes it potent by removing water. When you eat a fatty meal, your gut releases a hormone called CCK, cholecystokinin. CCK tells the gallbladder, "Squeeze now." The gallbladder contracts, shooting the concentrated bile into the small intestine to emulsify the fat. Problems arise when the liquid inside the tank turns into a solid. How do stones form? It is a chemistry problem called supersaturation. Bile is made of cholesterol, bile salts, and bilirubin. Normally, the bile salts dissolve the cholesterol, but if you have too much cholesterol or not enough bile salts, the cholesterol creates crystals. These crystals clump together to form stones. Risk factors, the 4 F's. Medical students are taught the 4 F's to identify high-risk patients. 1. Female. Estrogen increases cholesterol and bile. Women are twice as likely as men to get stones. 2. 40. Risk increases with age, usually 40 plus. 3. Fat. Overweight. Obesity increases cholesterol secretion. 4. Fertile. Pregnancy causes high estrogen and slows down gallbladder emptying. Bonus risk. Rapid weight loss. If you lose weight too fast, crash diets, the liver dumps extra cholesterol into the bile, and the gallbladder stops emptying as often. This is a massive trigger for stones. Most gallstones are silent stones. They sit at the bottom of the tank and cause no problems. We leave these alone, but if a stone moves and blocks the exit pipe, cystic duct, you get pain. 1. Biliary colic, the attack. Sudden, severe pain in the right upper quadrant, under the ribs. Often radiates to the right shoulder blade, scapula, due to shared nerve pathways, referred pain. Triggered by fatty meals, lasts 1 to 5 hours, then goes away as the stone falls back into the gallbladder. 2. Acute cholecystitis, the infection. If the stone gets stuck and doesn't fall back, the gallbladder swells and gets infected. Symptoms: constant pain, doesn't go away, fever, chills, nausea. This is a medical emergency requiring hospitalization. How do we know? Usually, blood tests are normal unless there is an infection or a blockage in the main liver duct. The gold standard is an abdominal ultrasound. It is painless, cheap, and uses sound waves. Stones reflect the sound waves, creating a white spot with a black shadow behind it on the screen. If the ultrasound is unclear, doctors might use a HIDA-scan. This is a nuclear medicine test where they inject a tracer to see if your gallbladder is actually squeezing properly. Ejection fraction. If you have typical symptoms plus stones on ultrasound, the diagnosis is confirmed. If you have symptoms, the standard medical advice is, get it out. The surgery is called a laparoscopic cholecystectomy. We do not just remove the stones, we remove the entire gallbladder. Why? Because the gallbladder is the problem. It is the factory making the stones. If we just took the stones out, they would reform within months. The surgery is minimally invasive, keyhole surgery. Usually it involves 3 or 4 tiny cuts. Patients often go home the same day. Is it safe? Yes, it is one of the most common surgeries in the world. Can you live without it? Yes, your liver still makes bile. Instead of being stored, the bile just drips continuously into your intestines. You can digest food perfectly fine without the storage tank. Are there side effects to removing it? For about 10 to 15% of people, there is a condition called post-cholecystectomy syndrome or chronic diarrhea. Because bile is dripping into the intestines constantly, even when you aren't eating, it can act like a laxative. The solution: 1. Diet. Avoid super fatty meals for the first few weeks after surgery. Let your body adjust. 2. Fiber. Psyllium husk can bind the excess bile. 3. Medication. Bile acid sequestrants, like cholestyramine, can soak up the bile and stop the diarrhea. For most people, the body adapts within a few months, and they can eat whatever they want again. What if you refuse surgery? Are there pills? Yes, but they are rarely used. The drug is Ursodiol, ursodeoxycholic acid. It is a synthetic bile acid that can slowly dissolve cholesterol stones. The downsides: 1. Time. It takes 6 months to 2 years to dissolve the stones. 2. Success rate. It only works on small, pure cholesterol stones. It does not work on calcified stones. 3. Recurrence. Once you stop taking the pill, the stones usually come back within 5 years because you haven't removed the factory, the gallbladder. This option is usually reserved for elderly patients who are too frail for surgery. Now, we must address the internet trend, the gallbladder flush. The recipe usually involves drinking Epsom salts, followed by a large amount of olive oil and lemon juice. The next morning, people pass dozens of green, stone-like blobs in their stool. They think, "Look, I passed my gallstones." The scientific truth? Those are not gallstones. They are soapstones. When you drink a massive amount of oil, fat, and lemon juice, acid, they mix in your stomach and undergo a chemical reaction called saponification. You are literally making soap balls in your gut. Chemical analysis of these stones shows they contain no cholesterol or calcium. They are made of olive oil molecules. The danger: if you actually have large gallstones, drinking a cup of oil triggers a massive contraction of the gallbladder. This can force a real stone into the duct, causing a blockage, pancreatitis, and landing you in the emergency room. Do not do this. It is fake science. So, how do you actually prevent them? 1. Coffee. Studies show that regular coffee consumption reduces gallstone risk. Caffeine stimulates gallbladder contraction, keeping the bile moving so it doesn't settle into sludge. 2. Fiber. Eat more vegetables and whole grains. Fiber reduces the saturation of cholesterol in the bile. 3. Vitamin C. Some data suggests vitamin C helps convert cholesterol into bile acids. 4. Slow weight loss. If you are losing weight, aim for 1 to 2 lbs per week. Do not crash diet. Rapid fat loss floods the liver with cholesterol. To conclude, gallstones are common. If they are silent, no pain, leave them alone. Do not do a flush. Do not take herbs. Just eat healthy. If they are symptomatic, causing attacks, listen to your doctor. Surgery is the safest, most permanent fix. Living with the fear of the next attack or risking a burst gallbladder is not worth it. The gallbladder is a storage tank you can live without. Don't let it ruin your life or your pizza night. Thank you for joining this masterclass on Metta Health Talk. If this video helped you understand that pain in your side, please subscribe and share it. Stay healthy.